So my name is Stephane De Brito. I'm an associate professor in the School of Psychology and the Center for Human Brain Health. And I do research on antisocial behavior and the impact of childhood maltreatment on the brain. So the research in our lab is focusing on understanding the development of severe antisocial and violent behavior across life. So we're looking at children, adolescents, and adults who exhibit very severe form of antisocial and aggressive behavior. So we're looking at things like diagnosis of conduct disorder, antisocial personality disorder in adulthood, or psychopathy. Another part of the research in the lab is about understanding the impact of childhood maltreatment, early adversity on the brain. Let me give you an example really for you to understand what we do in the lab in terms of understanding how the environment and neurobiology may interact. So think about a family. So this family, there's a lot of violence in the home between the mom and the dad. There's abuse of substances, alcohol, drug. They live in a neighborhood where there's a lot of violence, and they have 4 children. The first child is showing forms of really severe antisocial and aggressive behavior. Very, very antisocial, very aggressive. The second child is actually very depressed, very withdrawn, showing high level of anxiety. The third child is actually a mixture of the first two, showing antisocial, aggressive behavior, but at the same time being very anxious, very depressed. They're all kind of struggling at school. And then the fourth child is actually doing really well. He or she is doing well, not being antisocial, not being aggressive, doing well at school, very well adapted, having friends. And so the research in our lab is really to try to understand how come these 4 children who share part of their genes, the same environment, have this kind of drastically different outcome. So the research in the lab is to understand the environment, the neurobiological factor that are at play to kind of understand these different outcomes. So we use a lot of different techniques to understand the brain. So one of the techniques that we use the most is MRI, magnetic resonance imaging. So we take very detailed picture of the brain to look at the structure of the brain, to understand how the gray, the white matter kind of is associated with different forms of behavior processes. We also use functional MRI, functional magnetic neuroimaging. So here we understand how different parts of the brain, how different region and network of region are implicated in certain forms of behavior, decision making and processes. We also use neuropsychological tests. So these are tests that you can do on a computer to look at how you make decision, how you process emotion, how you process stimuli in your environment. Our research in terms of impact has been very important for practitioners, so that is teacher, psychiatrist, psychologist, social worker, to understand how the environment may become embedded in the brain. So how the environment might shape how the brain responds to certain stimuli. So for example, the research we've conducted looking at the impact of family violence has shown that children who are exposed to this kind of high level of violence in the environment, their brain overreact to certain stimuli. They are hypersensitive to threat. What is important to understand is that these changes are not permanent. The brain is plastic, and there's now good evidence that these kind of hypervigilance that we observe in the brain are not permanent. And so our research has been really useful to inform practitioners in terms of understanding the behavior of children, what might be some of the reasons why they behave in certain way. Why might they be distracted at school? Why might they be hypersensitive to threat or frustration, for example? Another part of our research, which we are really now focusing on, is to inform practitioners, but also the general public, about severe form of antisocial behavior in children. Often these children are just perceived as being naughty and antisocial, but at the very extreme end of the continuum, children who show severe and antisocial aggressive behavior actually suffer from a psychiatric disorder that we call conduct disorder. So this psychiatric disorder impacts their home, school life, a vast array or ranges of aspects of their life. And actually we know now that this disorder is associated with the greatest mental health burden across the globe in children aged 0 to 14. So we're doing a lot of work to raise awareness about this disorder and that it should be considered as a psychiatric disorder which we think has potential neurodevelopmental origins.